Hello, I'm Dr. Judy Mackall, a cardiac electrophysiologist at the Harrington Heart and Vascular Center at University Hospitals Cleveland Medical Center. I'm here today on UpBeat TV, part of the upbeat.org Patient Education and Caregiver Network of the Heart Rhythm Society. What is a cardiac electrophysiologist? Well, it's a specialist in the treatment of heart rhythm disorders. Often, abnormal heart rhythms can be treated with medication or a procedure called catheter ablation. But sometimes patients are at risk for a very serious heart rhythm called ventricular tachycardia or ventricular fibrillation. These rhythms can be life-threatening, and an implantable cardioverter defibrillator or ICD may be recommended. I'm joined today by my patient Ian, and we're going to spend the next few minutes hearing about his clinical condition and his experience of living with an ICD. So welcome, Ian. Can you tell us a little bit about yourself?
Hi, Dr. Mackall. It's very nice to be with you. Thank you for having me. My name is Ian. As you said, I'm 52 years old. I am married for 22 years to my lovely wife, Lisa. We have three children. Let's see, a 20-year-old junior at the University of Cincinnati, an 18-year-old soon to be freshman in about 3 weeks at the University of Clemson, and then a junior in high school, a 16-year-old boy. And we live in a small suburb of Hudson, which is right outside of the Cleveland area.
I think you sound like you're very busy, so I'd like to thank you again for taking the time to meet with us today. Can you tell us about your medical condition and why an implantable cardioverter defibrillator was recommended for you?
Well, so way back in high school, which seems like ages ago now, I had some episodes where I had mild chest pain, but more shortness of breath. And so, upon minor exertion, walking upstairs in school, things of that nature. And at that time, I did a Holter monitor study, which I'm not even sure if those are even still around anymore, where I wore a tape recorder, taped to my chest for, I think, 24 hours. And at that time, that's when it was discovered that I had this hypertrophic cardiomyopathy condition that I've been living with all my life.
So, hypertrophic cardiomyopathy is probably the most commonly inherited heart disease. About 1 in 500 patients have it, maybe more. It's associated with an abnormal thickening of the heart muscle, and the thickness can sometimes obstruct the outflow of blood from the heart and cause shortness of breath when you're exercising. And so Ian was treated with a procedure to decrease the thickness of the septum. And I think that was successful, but the result was this observation that he was having some ventricular tachycardia. And the concern was that, gosh, that could happen again. And it was unpredictable. And so the defibrillator was recommended. So, how old were you when you got your defibrillator?
I was 25 years old. It was July of 1998 when I received my first defibrillator.
And do you know what kind of defibrillator you have?
I do. I have a transvenous dual chamber ICD, which means I have one lead or wire that goes into my atrium, and I have one that goes into my ventricle.
And so do you know how it works?
So I can explain it most simply as like a seatbelt, and it's sitting there watching my rhythm in my heart. And if for some reason my heart gets out of rhythm and it can't bring itself back, then the ICD is there to deliver a shock to my heart to bring that rhythm back that it couldn't bring back on its own.
Most defibrillators that are transvenous will give an attempt to try to pace back to normal rhythm. But if it's unsuccessful, it will go ahead and deliver that internal shock. Have you ever experienced a shock?
Well, yes, I have. I've received several shocks, as a matter of fact.
What did that feel like?
Well, it's not the most comfortable thing that I've ever felt. It's actually pretty uncomfortable. Um, and I think the discomfort is mainly because it comes out of nowhere. A lot of the times you're not expecting it. So it's more of a sudden kind of a jolt, like maybe someone kind of punched you in your chest and you weren't expecting it.
Is there any residual pain after the shock is delivered?
Not usually. I've had a couple episodes where I've received multiple shocks, and so the area around the defibrillator was a little tender for maybe a day or so, but nothing residual once the ICD has done its job.
Mhm. Um, so after you got a shock, did you know what to do?
Well, I do now, but the first time it happened, I didn't. It was a pretty scary thing because I was just walking down the street on a busy street in Cincinnati, Ohio, and I received quite a few in a short amount of time. Um, and at that time, I didn't know what to do, so we called, 911, and I was taken to a local hospital in Cincinnati, and that was the first time. But now that I've had a few and I kind of understand what's happening, I don't have as much anxiety about it. I think we just know that we should probably call 911, explain to them what's happening when they get here, go to the hospital, and I don't even usually end up spending the night sometimes, but it's usually an overnight stay at the most if I do.
I'm calculating in my head 26, 27 years of living with a defibrillator. And what's involved with that? Like how are you followed? What's the regular follow-up for you?
So every 3 months, I have a device that I send information over to you in your office that allows you to kind of track and monitor everything that's going on, so I don't have to come into the office. But once a year, I do come into your office and have a really deep look into what's going on with the device, checking battery status, checking any rhythms or arrhythmias that I may have had during that time, checking my lead status, making sure to just give a total look into the function of the device and also into the status of my heart as well and those rhythms.
Yeah, I think that, the device, we tell the device what to recognize as abnormal, and it's primarily a heart rate detector. So as soon as those heart rates jump up over 200 or 210 beats a minute, the device goes on to high alert and waits to see, are you going to come out of it, not going to come out of it? What does it need to do? And you have had really two rhythms that we see in hypertrophic cardiomyopathy. You've had the ventricular rhythms, but you've also had atrial fibrillation. And I think some of your shocks, if I'm recalling correctly, have been for atrial fibrillation. And
And
so I think we call those inappropriate shocks, but also appropriate shocks. And fortunately, those are much easier to deal with now than they were initially when you first got your defibrillator. So you've had a few defibrillators because the batteries don't last 26 years. What's the replacement like?
it's actually pretty fairly simple procedure from my standpoint. I don't know about yours, but for me, I'm pretty much asleep for most of the procedure. I'm brought into the hospital, and the procedure's done in the cath lab, and I don't really feel anything. I know that you're in there. I can kind of hear people talking and making jokes about me and things of that nature. No, I'm just kidding. I'm just kidding. But I can hear people talking, but I don't feel anything. And then the device is tested to make sure that it's going to do its job effectively. I don't feel any of that. And then I wake up in recovery, hopefully to lots of juice and snacks, and on my way home the same day. It's really, from my standpoint, quite a simple procedure.
Um, Sometimes because the devices are hardware and software, uh, there are issues that turn up after the devices have been released and are being implanted. And when the company recognizes that, they issue a safety alert or a safety notification. Have you ever had a device that's been put on safety alert?
I have. I had one where there was a lead that had an alert, and I managed it through your office, and from my standpoint, there was really no difference from my therapy. It didn't change what I did on a daily, from a daily perspective. It was really, something that it was great to know that that was happening, that there was an alert, but it didn't limit me in any way.
Yeah, many of the device alerts can be handled with software programming and programming changes to prevent device malfunctions. Um, so do you have any symptoms now that you have the device in all these years? Do you forget it's there?
Yeah, I have symptoms every once in a while from my condition, but not from the defibrillator. I really don't know that it's there. I don't have really any restrictions, lifestyle restrictions at all. Uh, the only time I really know it's there is when I see it when I'm, getting dressed, but otherwise it doesn't limit me. And it doesn't keep me from doing the things that I really like to do, especially my terrible golf game. If it did limit me from that, maybe I would have a problem, but since it doesn't, it'd be nice if it actually helped my golf game, but I guess they can't do everything.
Um, I was going to say, we always tell people it improves your golf game, but I wanted to just show what a device looks like. These are the defibrillators. This is roughly the size of the defibrillator that goes into the usually left upper chest, but can be right upper chest or subcutaneously. And most of the batteries tend to last 7 to 9 to 12 years, depending on how often it's used. Um, so you were talking about restrictions with the device. Do you have any lifestyle restrictions because of your device?
Not really. I mean, I probably shouldn't be lifting heavy weights in the gym and things of that nature, but at the age of 52, I'm really not looking to do that anymore, anyway. But outside of, doing any overly strenuous activities, I really don't have any restrictions or limitations to my life. It's really um, good that there's a seat belt in there in
Mhm.
case, I need it.
How do you find like traveling through airports? Do you have any issues when you're traveling?
I don't. Very rarely, almost never, have any issues getting through airport security. I just tell them when I arrive um, that I have a pacemaker. I tell them it's a pacemaker because it's easier that way, and they let me go through the scanning machine. And if I ever do run into problems, I have an ID card that the company gives me with everything on it, and it does, say on the back here, my device may trigger metal detection systems. So they understand with this car, but they've seen it so many times at the airport. And I
Yeah.
actually used to travel a fair amount for work, and it was never an issue.
So to be clear, you're not going through metal detectors. those you show the guard your card and you kind of walk around, but you are able to go through the scanner, the
Yeah,
X-ray scanner at the airports, which most airports have now.
correct. Where you
Um,
put your hands up in the air and it spins around and gets to see everything that you
mhm.
have going on. But hey, there are worse things that could happen. So yeah, it's pretty easy to do.
Um, do you have anything, any other thoughts about your defibrillator or any other suggestions for patients who are thinking about a defibrillator or who received a defibrillator in ICD?
Uh, I would just say that if a patient is being spoken to about a defibrillator, it's for a very good reason. You know, these devices aren't implanted because they aren't needed to be. And I think the thing that makes my experience so great is because I have an awesome team. I have your office. As my electrophysiologist. I have another team of cardiologists that specifically looks at me and follows me for my hypertrophic cardiomyopathy. I keep my regular visits with that side every 6 months. I do my uh, communication every 3 months with my ICD. I see you at least once a year. And I think that because of that constant communication and interaction with your team and the other team, it's probably been the single most important reason why I've had such a good experience with my ICD is to just stay in regular contact, with those that are responsible for my care.
I have to say that, when I think about the benefits of ICDs to patients, I think about you. I think that, this technology has been great for you. And I think, you're having like this great life and it's going to be a long life and it's going to be pretty much totally normal, crazy life, sounds like.
Very
But I
much.
think I think you can have all of that with an ICD, and you're responsible, and you've found, you moved back to Cleveland, and you found a clinic and a physician and a team, and you're connected, and I think that that's part of it, and I think I really appreciate that you've taken the time to talk with us about it. And I hope that we can invite you back to talk about other aspects of your heart rhythms
No, that
abnormalities.
that would be fantastic. Thank you for having me and thank you for allowing me to have such a great life. I still get to exercise, I still can swim, I can still run, I can still do all those things that allows me to take care of my entire being, and I owe you and your team. Thanks for that.
You're welcome. Thanks for joining.
Thank you for having me. Have a great day.